Hey everybody, welcome back to the channel. Today we are going to be talking about chest seals. I posed the question in a video a couple weeks ago about adding a little bit more medical to the channel, and of the people that answered, I think the response rate was 100% yes. So here we are. We are going to be talking about chest seals. Super important, not the most important thing, but very high up there on the list. Full disclosure, full disclaimer, this video is not intended to substitute for proper medical training. If you do not have proper medical training but would like to use items seen in this video, I advise you to take a proper class, a stop the bleed, a CPR class, wilderness survival, whatever it may be. This video is not a substitute for proper medical training. What's worse than not helping is helping in an inappropriate way that might cause more harm than good. Thinking that you're helping but not helping is a lot worse than not helping. So get that out of the way. What is my background? I am a nurse anesthetist. I have been in the healthcare field for 22 years now, and I've seen a lot of stuff, not as much stuff as people out in the field, but I've seen some stuff. I feel that I have a good grasp on the concepts to be able to put this video out there for you. So first thing you need is a trauma kit. I made a video on this a couple of years ago. I'll link that up here. It goes over all the contents I have in this kit. I think you'll also see an older studio. Nice to see how far we've come along. But you want to know where your stuff is in your kit. So when I open this up, I know exactly where my chest seals are. They're up here at the top, and putting these in and out, doing numerous takes, this is kind of falling apart, and now it's falling apart. So we've got a twin pack of chest seals here. These are the compact version to fit in this Maxpedition case that I have assembled it in. And these are the smaller versions. You can also buy a larger version. You can also buy these individual, and then I believe they also sell a training version. Why are chest seals important? Well, chest seals are important in penetrating trauma wounds to the thoracic cavity, okay? This won't do any good on an extremity. It won't do any good on the abdomen. This is specifically for your thoracic cavity, your chest, okay? They're not the most important thing. If you're gonna carry one thing, I wouldn't carry a chest seal. I would carry a tourniquet. Tourniquets are by far the most important thing that you can carry on your person for doing field work, stopping bleeding of the field. In January of 2022, the hospital that I work at, we became a trauma center, and by far, I've seen more patients come in with tourniquets applied by EMS, by the police, than chest seals. I honestly can't think of a time where I saw a chest seal applied in the field. Not saying that doesn't happen, but by far tourniquets are way more prevalent, okay? So these are compact chest seals, like I said, and going along with having a proper medical kit, you want to wipe dirt and fluid from the skin with gauze, okay? There are instructions right here on the back of this chest seal. So like you want to have gloves and you want to have gauze. I have gauze right back here. That's compressed gauze. And then I also have quick clot and an Israeli bandage up there. So you want to have a proper medical kit. You also want to take care of yourself. You don't know what these patients have. You don't know what's going on. You want to protect yourself also. So, and this is where I'm going to overlay a picture of the chest seal. These do expire in 2 years, so I don't want to open them up and waste them because then they'll be no good anymore. So you grab the red tab to peel the clear liner from the dressing, and I'll overlay the picture to show it. Actually, I'm going to backtrack just a tad, and you can see these red tabs on the sides. If you ever tried to open a package and it just doesn't work, this is meant to take the difficulty out of that and open on the first try every try. If you can't get it open, it's useless. If your hands are bloody and they're slippery, this is meant to give you a head start in opening this package. They're on both of them, and it's meant to open every time, okay? So then you place the dressing on the patient, adhesive side down, centered over the wound. And now you can see the wound is in the center there, and there are 3 vents coming off the sides. The vents are there for a reason. We'll get to that in just a second. And then you firmly press the dressing to the skin for a good seal. If you don't have a good seal, it won't work properly, and then you might be doing more harm than good, thinking that you're doing the right thing, but you're actually not. So going back to the applications, these are for penetrating trauma wounds to the thoracic cavity. This won't work on an arm, it won't work properly on an arm or a leg, it won't work properly on the abdomen. It's mainly for the chest. Why is it mainly for the chest? Well, because of the 3 vents on here, the hyphen vent, the 3 vents are meant to allow blood to go out, and it's also meant for air to go out. When you take a deep breath in, it's going to press firmly against the skin and not allow air to go in. And when you exhale, air is going to go out. So this is not exchanging air inside your lungs per se, it's exchanging air within your cavity, your thoracic cavity, and that's why it's a penetrating trauma wound. So the atmospheric pressure is 760 inside your thoracic cavity, not in your lungs, but inside the lining between your lung and your chest wall. The pressure is just a little bit less. So you have an area of higher pressure and then an area of lower pressure, and the air is going to want to go in. And we are preventing that with this chest seal. But at the same time, you're allowing air and blood to go out. And that is why a chest seal is important. That's why it's vented, and that's why putting it directly over the wound is essential. And that's pretty much the anatomy of this chest seal. But again, I cannot stress enough, if you don't have a tourniquet, if you don't have any medical training, response times are getting longer. Rural areas don't have the response time that bigger cities. I know I have a fire station a few minutes down from my house, and I have a fire station a few minutes up from my house. But where I go to the range, you might be 10, 15, 20 minutes from medical help or response time, and that could be the difference between life or death if you do not have the proper equipment, the proper training, and the proper wherewithal to know when to use certain things and when not to use certain things. So having a chest seal is important. It's in that MARCH acronym that you see around in the training world. But the number 1 training item, or the number 1 medical item that you need, is absolutely a tourniquet. So if you don't have a tourniquet, get one. If you want to build a kit, there's plenty of places to build or get medical supplies from. I happen to have an affiliate with Dark Angel Medical, and you can buy most of these items on there. They also sell pre-made kits if you don't really know and you just want to buy a kit and throw it in your car, throw it in your range bag, whatever it may be. They have pre-made kits as well. I hope you got something out of this. This is kind of my first medical video. If you have any comments or critiques, let me know down below. That's going to do it for this one. Like and subscribe, leave a comment in the comment section below, and we will see you in the next video.